Good evening, everybody. My name is Dr. Nathan Thompson with Exemplify Health Center and the Wellness Way, Yorkville. Happy Monday evening, September 18th. You know what's interesting about today is it's called Founders Day. It's the day that the chiropractic profession was originally founded. So what is that? It's like 128 years, I think. The profession has changed quite a bit from its initial founding, just like everything. But the idea has always been the same, is that the body is wonderful, miraculous. It has the ability to be well. And when it can't is because there's too many mental, physical, chemical stressors. And that's exactly what we do, is that we identify physical, mental, chemical stressors, work to eliminate that, and allow the beauty of the body's ability to be able to adapt and heal on its own, to be able to do that. And that's what's missing, obviously, in healthcare today. You are not a machine. You are not a machine, and the parts just wear out, and you've just got to replace those or rub something on it or oil it to make it run better. We are a lot more complex than that. So question and answer tonight, guys. And anytime I have a question and answer, it really does mean I didn't have enough time in order to come up with the topic. And next week will also be a question and answer, only because I have to go out of town. And so I won't have enough time. 5 or 6 hours is usually what it takes to come up with a new topic. So before we go into question and answer, guys, a couple of things. Tomorrow night, if you are from the Chicagoland area, Inflammation Talk, register up at the top. If you are on Facebook or on our Linktree profile, inflammation, guys, absolutely huge. You got to handle that first and foremost. You got to learn how to not trigger it, because inflammation is the spark that leads to every single disease that's out there. So many people say, I want to work with you. I'm like, please get to the Inflammation Talk. It'll make your life so much simpler and cheaper. And also my life a little bit simpler too, because once you understand that, you'll understand really what it takes in order to move forward. And then also, guys, if you are from the contiguous 48 states, that does exclude Europe and Canada and Alaska and Hawaii, only because it's just really almost impossible to be able to take care of people the way that we really need to. But if you are from the contiguous 48 states, not in the Chicagoland area, you can go watch the inflammation webinar. Just go to our Linktree profile, and then you will see the inflammation webinar. If you got an hour, you can watch it right now, or you can schedule to see it on Tuesday or Saturdays. And then that will give you an opportunity to be able to schedule a one-on-one call with me, a discovery call, and kind of move the process forward. I know that we're filling up when it comes to remote consults, because they only have basically a morning to be able to handle that. But if you want to work with me, make sure you watch the inflammation webinar. I know that right before I started, we just had someone who registered for the inflammation webinar. So I do get an email to see who's registering for the inflammation webinar. And I also get to see who actually watches it. I can see who watched it all the way through. And remember this one, guys, I'll keep talking about this up until the day, October 24th, 2023, 6 to 9 p.m. It's on a Tuesday night, Whitetail Ridge golf course and golf club. Wonderful venue. Dr. Patrick Flynn himself is going to be making the trip down from Green Bay down to Yorkville, Illinois. He's going to be, he's on the I Disagree tour. And if you have been to the Hormone Connection event, I guarantee you got an amazing benefit from doing that. And this is a continuation of it. So yes, he's going to be talking about hormones, but he's going to talk about a lot of other things that he disagrees with when it comes to health, when it comes to healthcare. It is just an awesome event. I can't stress that enough. So if you are from Iowa or Missouri or Wisconsin or from Indiana, or you are in the great state of Illinois, make sure that you get your tickets. In a week, the tickets are going to be going up. So you'll lose the early bird discount. And then, so ticket prices, I think, are only $15, like literally the price of a movie, but this is going to be way better. And also, you don't have to pay $28 for pop and popcorn, because we will have food there for you. So this is a can't miss event, guys. Make sure that you get registered for it. And please do me a favor. Please register if you're going to come. Register now. The reason why is I don't know if this is good or bad, but I'm super competitive. And we are leading all other Wellness Way offices when it comes to registrations. And I want to blow everyone out. I want them to be successful, but I want to win. All right. I want to win. So please get registered for that. That is going to be an awesome, awesome event. So before we go into a couple of question and answers, hold it just for now. So that way I don't lose my place when it comes to the Q&A. But I want to go over a couple of things with you guys. And I actually saw this on when I was looking at some things on Friday and Saturday. I'm like, oh, I could probably do a whole topic when it comes to this. But here's a couple of things that came through some journals over the past about 2 weeks or so. Here's the first one. This is from September 8th from the Journal of Clinical Endocrinology and Metabolism. The title is Risk for Thyroid Eye Disease Rises Within 4 Weeks of COV, et cetera, et cetera. The thing. So I just have to watch what I say here. So we'll just call it the thing, and we'll call it also COV, et cetera, et cetera. So COV, et cetera, the thing, you know what I'm talking about. Here's actually what they said. They said that the risk of thyroid eye disease was highest in the first 14 days after the thing. Interesting, huh? This further strengthens the link between COV, et cetera, the thing, and the development of thyroid eye disease. You know what's really interesting about this is that they're confirming that there's an uptick in thyroid eye disease. And what is thyroid eye disease? It's attributed to Graves' disease, which is an autoimmune hyperthyroidism. And in fact, if you go back to Rumble, which is my very, very first video on Rumble, I said this: hey, after looking at blood work, this looks like there could be the possibility of an increase in in autoimmunity, only just by looking at blood work. And I was absolutely slammed, video taken down and everything. But guys, you can go back and watch that video. I think it's been viewed probably 20 million times, but it got taken down off of YouTube. But you probably can find it somewhere, but you can find it directly from me on Rumble. But there is a confirmation now. They're saying this is that there is an increase in autoimmunity, specifically thyroid eye disease, i.e. Graves' disease. And the highest risk is 2 weeks after the thing. So I found that really interesting. So number two, here's another study. And this, it talks about SGLT2 inhibitors and hydrochlorothiazide lowered sympathetic nerve activity. So what is an SGLT2? What is that inhibitor? It's basically a type 2 diabetes medication. They use it as a first line of defense, usually with metformin. Basically what it does is it causes glucose excretion. So it inhibits glucose reabsorption from the kidneys, allows for glucose secretion, which then takes sugar out of the blood and then you urinate it. And those are for people who have high blood sugars. And then also hydrochlorothiazide is a diuretic. Okay, so they use that when people can have high blood pressure or if they are retaining water. But what's so interesting is that they're looking at the benefit to the sympathetic nerve system. So what they say is reductions in sympathetic nerve system activity may contribute to beneficial effects of sodium glutamate transport inhibition on cardiovascular outcomes. So what's so interesting, guys, is that you talk about cardiovascular disease. You have one specialist that say it's all about cholesterol. And then you have another specialist that's, then you go to another specialist for your blood sugar control. Then you go to another specialist, an immunologist, and you go to another specialist for your hormones. And it's almost like they just have a myopic view on chronic disease and they just have one specialty to affect one different thing. But you need someone to look at it from a 30,000 foot view. And what they're saying is there's a role in the sympathetic nerve system in cardiovascular disease and blood sugars and things like that, which we have always said, because when the body is in fight or flight, it affects the gastrointestinal system. It affects your blood sugar. It affects the constriction, vasoconstriction of your arteries. This is why, guys, that stress, whether it's mental, chemical, or physical, is absolutely long-term devastating to the body. The body can handle it for a short period of time. And in fact, it's supposed to be able to handle for a short period of time. But if that stressor, i.e. that bear, never ever goes away, there is a devastating effect on the body, even mental stress. But what's so interesting is they're saying, hey, if we give people medications, it can lower sympathetic nerve system activity. You know what I say instead? Why don't we just get to the reason why there's an increase in sympathetic nerve system activity? Are there problems with physical stressors? Are there chemical stressors? Is there mental stress? But see, the whole thing with medicine is that we come to the same conclusions on what causes disease, but at the end of the day, in every single study, they're always talking about how we can manipulate this with more and more meds rather than get to the reason why and honor that the body is smart, it knows how to heal, and give people personal responsibility when it comes to their health. Here's another one. You'll find this interesting. The title is No Need for Alarm. Usually, when they say that, there is probably a need for alarm. Kind of like, when my kids were growing up and they would come into the family room and they would say, I didn't spill the water. Usually it was them who did it. So no need for alarm, despite associations between certain GI conditions and Parkinson's. Okay. So they have looked at some research now, and some of the research that's coming out that's actually saying that, hey, there's an association with GI issues and later on having Parkinson's. Okay. So here's what they say: functional dyspepsia, or having delayed gastric emptying, irritable bowel syndrome with diarrhea, and fecal incontinence were not specific to Parkinson's disease. But what they say is that a case control cohort analysis showed that dysphagia, gastroparesis, irritable bowel syndrome without diarrhea, and constipation may be associated with an increased risk for Parkinson's disease, according to research in the medical journal Gut. Okay. We have been doing experimental studies that have shown that the pathological molecule that is associated with Parkinson's disease can indeed travel from the gut and affect the brain. So it can affect the gut and can travel, or that affects the gut can now travel to the brain. So, so when you think of this, they are seeing, hey, is there an association between what's happening in the gastrointestinal system and Parkinson's disease? You look at Parkinson's disease. With Parkinson's disease, you're seeing that very low dopamine. There's destructions of a portion of the brain known as the substantia nigra. But also when you look at dopamine production, that's actually coming from the adrenal glands as well, which is why people with Parkinson's disease have such low energy. If you ever measure their adrenal glands, they're just absolutely tanked. I do have testing that we did on an individual with Parkinson's disease, and we did a food allergy test. We also did a stool test. Here's what's interesting, because I looked at this, I'm like, I remember this testing. There's an individual with very advanced Parkinson's disease, 26 different food allergies, very hyperpermeable gastrointestinal system, small intestinal barrier. But if you look at the stool test, you actually see really low pancreatic elastase, meaning low enzyme activity, a lot of gastrointestinal issues. Because remember, if you are low in pancreatic elastase, you are not secreting pancreatic enzymes to be able to digest and break down your food. Also, a high amount of fecal fat, which can be related to gallbladder function, pancreatic function, and also the gastrointestinal barrier. But what's interesting, if you look at the fecal secretory IgA, and his was just absolutely through the roof. And when secretory IgA is through the roof, it's the immune system is putting general antibodies along the gastrointestinal barrier because it really thinks that it's under attack. So a high amount of gastrointestinal barrier inflammation, and then also high what's known as beta glucuronidase, guys, you can look this up. High beta glucuronidase will actually lead to detoxification, retoxification. And this is especially true, especially with women when it comes to their hormones. It can be a reason for estrogen dominance or the inability to be able to clear their estrogen. So I found that interesting that they're linking the gastrointestinal system to Parkinson's disease. But even when you look at Parkinson's disease, look for people with gastrointestinal infection, high amounts of inflammation, but also there has to be some kind of toxicity component to it. All right, guys. So let's go over some questions, and let's see that if we can answer some of these questions as best as possible. Someone did send me a question. I don't necessarily ask people to send me questions. Some people send me one for the live. But this woman, she had a question. She said, my daughter had blood work done and her thyroid antibodies came back to 1300. What would your first step be? So there's two types of antibodies that we measure: thyroglobulin and thyroid peroxidase antibodies. So I'm going to guess by that number that it's thyroid peroxidase. Basically, what it means is that if it's at 1300, there's been some level of destruction that's taking place to the thyroid, because those TPO antibodies, thyroid peroxidase, belongs in the thyroid cell. It doesn't belong in the blood. And if it's in the blood, the body will attach, the immune system will attach an antibody to it, which means there's been some level of thyroid destruction. So if you look at, can people have normal thyroid levels, normal thyroid stimulating hormone levels, and still have TPO antibodies? The answer is yes. We see it all the time. But it's one of those things where if you are doing it, if you have it, then there hasn't been enough destruction yet to cause the low thyroid hormone, if that makes any sense. There's a lot of different reasons why someone can have low thyroid hormone. And I've talked about this a lot with all of the different types of reasons. But if there is TPO antibodies, then I want you to think that it's immune. It's immune. It's immune. Two of the biggest things that can cause an immune reaction to the thyroid is so normal thyroid levels, there's a lack of antioxidant support, in which case selenium is going to be very, very important. And then the other thing is there could be some kind of viral component to this as well, like Epstein-Barr virus. So how we actually handle it is a lot of immune system support. And we try to stabilize things as much as possible. In fact, I just had a woman who the other antibody levels that we count is thyroglobulin antibody, which is also like a carrier protein within the thyroid. Her levels have gone down in 4 months. They've gone down by about 60%. So, and doctors say there's no way that you can do that. But I don't want to say that I did it. She did it, and she was given the direction on exactly what she needs to do. So how did you move forward with this? Like probably what I would do is I would test this a lot deeper. So I would probably test all antibodies, probably test free and total T3, T4, probably measure TSH again, because that is highly variable depending on the time of day that you do it. But then, excuse me, also look at other markers that we look at, DHEA, look probably at the estradiol levels too, sex hormone binding globulin, probably look at her ferritin levels as well, and then really try to figure out what's driving this. So probably get a food test done, maybe even a stool too, just depending on some of the symptoms that are going on. So what's interesting too, if there's all those are normal, a lot of times maybe a doctor would say, well, we're just going to go ahead and we're just going to watch it. I'm like, watch it do what? Get worse? So that's why, same thing, if someone comes back and they have low immune cells, this individual, we went over her new blood work, was low in immune cells, and they didn't do anything about it. And so I'm like, okay, you're low in immune cells. Here's what you need to do. And we tested again, and immune cells pick back up to normal. So test it deeper, but don't just watch it get worse. You want to get to the reason and to the mechanism as far as why it's happening, because if you don't, at some point you're going to see thyroid function go down, and then at that point the doctor is going to say, yep, you got to go on Synthroid. Although we do have some people with a lot of thyroid destruction, we recommend going on a desiccated thyroid instead, but not a lot of doctors want to do that, only because it makes their blood work not look normal. So you really have to know what you're doing when it comes to looking at blood work. So thank you guys so much for that question. Let's take a couple of questions from the audience. And I know I guarantee I've skipped over someone, so I apologize. So, all right. All right, if my blood work shows high free testosterone, but my Dutch test shows it's on the lower side, what does that mean? And also blood work that shows high reverse T3. Okay. All right. So if your blood work, that's why you always measure. You really want to measure hormones in blood and in urine. Okay. However, is that this is showing production in the blood, and a Dutch test is showing how it's getting metabolized. So there may be high production, but it's not metabolizing very well. So that may be the difference between the two. You can have some differences too if you are from Asian descent. If you are Asian descent, you always will have low testosterone on a Dutch test. That's just genetically, they're just a little bit different. So This is why I always measure production, and then you always want to measure how it's getting metabolized in both. Okay. And also, if you took it at different times, that can also influence it too. If your blood work shows high reverse T3, all thyroid levels are normal. I would say, are you on anything that could be causing? Are you any kind of thyroid replacement? Or also, high reverse T3 can indicate high amounts of stress. If you're on a thyroid replacement and you're running too high, you also have high levels of reverse T3. You also have high levels of reverse T3 when you're sick. So if you're sick, I remember I had a woman, her reverse T3 was the highest I'd ever seen. I looked at this like, something's not right. You should probably go to your MD, get some further testing that's going on. And she ended up having cancer. So, and we caught it just by looking at reverse T3. And so she ended up having lymphoma, and they did catch it pretty quick. She's doing fine now. All right. So let's see. Let's take a question. All right. What do you think from Doug Cathy? What do you think of cleanses and detoxes? Okay. Cleanses and detox. Well, if someone is promoting a cleanse or promoting some kind of detox, I will probably say that it's probably not legit. And I also say that with, we do actually do detox, but a lot of people who are doing cleanses and detoxes couldn't write out phase 1 and phase 2 of detoxification and then all of the detoxification pathways. I will say that. Methylation, glucuronidation, sulfation, all of these different things. And guys, basically when we say, yes, we detox, basically what we're doing is we're working on pulling fat, which is where toxicity is stored, fat and neurological tissue, pulling fat, helping it to become water soluble in the liver, and then attaching a methyl donor, for example, to it to be excreted through the either gastrointestinal system by way of the gallbladder or through the kidneys. And if that gets backed up, you'll see it happen through the skin as well. So most of the time when people bring me a cleanser or detox, I look at this and I'm like, doesn't have a high enough amount. It doesn't have a high enough amount in order to be able to make a difference. And so every cleanse and detox, probably what you will see is you'll probably see N-acetylcysteine. You'll probably see milk thistle. You may see like some Schisandra in there. You may see some things to help with estrogen metabolism. You may see those things, but I'm going to tell you, if it's in like pill form, it's probably not enough at all. So I think a lot of them are overblown. And you also got to be careful, guys, is that if you're low in iron and you're always stimulating the liver, like that, you can actually go into anemia doing that. So I think if someone knows what they're doing, then it's great. But just remember, there's no such thing as a colon cleanse. And the only thing that you can do is help support detoxification, because your body does do it all the time, but it can only keep up so much. So, and that's why too, you have to feed those pathways in order for that enzyme activity to be, in order for them by supporting those pathways in order so that it doesn't get backed up either in phase 1 or phase 2 of detoxification. Great question. Let's take another one from Facebook. Is there a way to heal oneself from being double the thing, if you know what I mean by that? I have seen patients. The only thing we do is I don't think that there's a protocol with it. Is we look at labs. One of the things that I've seen in people who did have double, the thing, like really big elevations, a low, an impaired immune response, especially to a viral. Any kind of viral component to it. And that actually backs up what happened when everyone was getting the thing and how you saw a spike in Omicron. And then, but the other thing is too, so really high elevations of homocysteine levels. And that can actually cause very poor detoxification. It means that your methylation pathways are really, really struggling and backed up. In fact, I remember I had a guy who his homocysteine levels were 30, which is twice as high as it was. And we did the right things, supported it, and then got it back down, and blood work returned back to normal. Okay. All right. Let's take a question from Instagram now. How do you restore optimal gut bacteria balance. The first thing that I would say is measure it. So you can measure it. So we do a stool test through Genova. Usually we do it for 3 days. And a 3-day stool test you're much more likely to catch a parasite if you do it for 3 days versus one. So then they do actual PCR testing on the presence of certain DNA in the stool. They don't amplify it 45 times. And then you can see the presence of what type of bacteria are within the gastrointestinal system. But I will say this is the number of times that I tell people to go on a probiotic, most people would say everyone needs it, but I probably only recommend it about 10% of people. Most people have an overgrowth. They don't need necessarily a probiotic. You know what they need the most? Because what regulates that gastrointestinal bacteria? It starts with stomach acid and it starts with proper bile acid formation. So those things are things that set the environment for the bacteria that are supposed to be there to grow. And it's kind of like I always tell people, they're like, should I be on a probiotic? I'm like, with that environment, you could throw probiotics in there and it's not going to change anything because there's a reason why those bacteria are growing because the environment is suitable for it. You need to change the environment first and foremost. And then you can consider going on a probiotic after that. So this is why stomach acid, bile acid is important. Heck, this is why people's gastrointestinal system goes just haywire when they get their gallbladder out. And the number one thing that people will say is like initially I had a lot of loose stool diarrhea that turned into constipation. And so with the inability to be able to store and concentrate your bile and be able to release enough of it to be able to digest and break down and emulsify your fats, then that changes the bacteria profile lower. And you'll see like Methanobrevibacter smithii is what it's called, Mr. Smith, which is a methane-based bacteria, and it gives off, it metabolizes its off gas that it gives as methane, which tends to really paralyze the bowels. So that's why starting above is the first thing to do. And do you need a probiotic? Maybe, maybe not. Sometimes oregano is needed. Sometimes stomach acid is needed, being on a bile acid replacement. Sometimes that's needed. And sometimes, people they need an environment to help to kill off infections. And that can be things like berberine, uva ursi or oregano or something like that. But you shouldn't be on oregano for a long period of time, especially. So, but first and foremost, start and get it tested first. Do you agree that diet is the issue for high LDL? Well, that's the thing is that diet doesn't necessarily contribute a lot to having elevations of LDL, maybe only like 10 to 15%. I should say this as far as eating cholesterol and raising your cholesterol levels. This just goes under the whole debate is LDL, is that the most important marker? Is that the most important indicator? And so I don't think that that's the most important indicator. Cardiologists would wholeheartedly disagree, and they would disagree, and they would say that everyone with an LDL over 100 should probably be on a statin. But then I'm like, yeah, but look at that. You're going to see lower cholesterol, but you're also going to see that it reduces your absolute risk after about 10 years by about 2%. But then the other thing is how many people have negative side effects of being on a statin drug? How many of them do? And depending on what you look at, it's 15%, 20% are people having joint and muscle pain and things like that. Are there other things that you should look at first? Yeah. So look at your insulin levels, look at your C-reactive protein, because there's so many other factors, guys, than just cholesterol that's leading to heart disease. And I think I talked about this with menopause and high LDL as well. So great questions, guys. Great questions. All right. I'll post this video later. Yes, absolutely. I'll save it and then post it to our page. All right. All right. Let's take another question from Facebook. Actually, here's one from YouTube. Here's interesting. All right. So, what helps with POTS? The syndrome will finish me if I can't find something that helps. Okay. So, with POTS, positional orthostatic tachycardia syndrome. And I want you to think of this: your blood pressure goes low in certain positions. This is an issue with adrenals. Do I have a problem with the adrenals? No, the adrenals are down regulating. Um, and I want you to think what causes low adrenal output. It's something involving the immune system. It is. It is the immune system. And so that's why, I mean, think about when you're sick, guys. Think about when you're sick. So if you're having low adrenal output, just think you're going to be low in dopamine. You're going to be low in epinephrine, norepinephrine, adrenaline in order to raise your heartbeat. That's why when you get up from a position and you get dizzy, because you're going to be low in adrenaline. And then also too is you probably our blood sugars are running low too. Well, what helps you to raise your blood sugars? That's actually the hormone cortisol. Where does it come from? It comes from the adrenal glands. So you have to look at the adrenal glands, but then you have to figure out, get it measured, then figure out what on earth is going on. And usually there's some kind of infection that's going on. Okay. So Roxy, what I would do is please go to wellnessway.com, find a doctor that's close to you, and I guarantee they'll test you properly. All right, so fasting. There's a fasting question from Scott NYC. Fasting is a way of healing. Okay, now this is coming from someone who has fasted, fasted a lot. The thing is that the intentional abstaining from food can actually help you. There's no doubt about it. But I have someone who's fasted multiple times for 2 days, multiple times for 3 days. In fact, I will fast for 3 days about 4 times a year. And I've also this year done a 5-day fast, and the longest I've gone is for 6 days. It isn't necessarily that I need to do it, but I also want to do it to tell people about it, like saying, like, here's what happens, because I have recommended it for people. Is there anything magical about fasting? There's a benefit to fasting, but I think that it gets overstated. And here's the reason why. Someone fasts for 3 days, let's say. They come back for 3 days and they say, oh my gosh, I lost 15 pounds. And I'm like, you didn't lose 15 pounds of fat. They're like, well, what did I lose? You lost 15 pounds of water. Well, where did that water come from? Well, you blew through your sugar stores, which carries water. But then also, too, here's where people think it becomes magical. If someone has a lot of food allergies, IgG food allergies, and then all of a sudden they withhold from food so that they do the ultimate elimination diet, which is eliminate all food, then they will not get an inflammatory response from any kind of food protein, which is why they feel many times so much better. So that's why I tell people, hey, if you want to get some of the benefit of fasting without having to go through a fast, know what your food allergies are. And then you're going to realize, hey, I ate this food or I ate a dinner and I didn't put on 8 pounds of water weight as a result. Now, after you get into 48, 36 hours, you get this whole idea of autophagy. Here's what happens. The immune system, the body says, if we're in starvation mode, we need to go into efficiency mode. So clear out anything that is senescent, old, on its way out. And so basically it's kind of like, when you get a pay cut at your job and you go home and you figure out, I don't need Netflix, I don't need HBO, I don't need Paramount, I don't need all of these things, I'm going to get rid of them, and you become more efficient with your money. The body becomes more efficient with these cells as well. So am I against it? Absolutely not. Am I for it? Yeah, I kind of am, but also saying here's really, really what happens with it. And I actually do it just more from the mental aspect, just to make me so tougher and not weak. So great question. Yes. All right. So let me take another one from Shelly Carlin. Shelly, how are you? It's good to see you. And then I'll take another question from Vika ESQ. I'll take about stomach acid. Lame question. What's the best way to take the megabiotic? I didn't realize that it is a powder. You can actually just spoon it in your mouth and drink it down, or you can also put it in a smoothie. So either way, you just got to make sure that it's refrigerated, because they are live cultures with that. So There's no such thing as a lame question. The lamest question is the one that that people feel bad to ask. Okay, so um, so let's take a question from Instagram, and I'm trying to get to all of them. How do you lower stomach acid? An upper GI scope biopsy came back negative for bacteria and other scaries found out have areas with erythema. Well, the thing is there's really no such thing as um, having too much stomach acid. Okay, and I want you to think of this is if you understand neurology has your autonomic nerve system has two divisions. It has a parasympathetic division and it has a sympathetic division. Sympathetic is fight or flight, parasympathetic is rest and digest. In order for you to release stomach acid for peristalsis or gastrointestinal movement, in order for you to release bile, digestive enzymes, all of that is a function of rest and digest. Whenever you're in fight or flight, stomach acid goes down. Movement in the gastrointestinal system basically becomes non-existent. And so when people say I'm making too much stomach acid, it would be like saying I am in too much rest and digest. It would almost be like I have too much stomach acid now that I slept for too long. No one is in too much rest and digest, but a lot of people are in constant stress and fight or flight. Fight or flight lowers the stomach acid. And what happens is when that stomach acid is lower, you're going to have things that are going to stay in their stomach longer in order to break down the food and sterilize the food. And then it also, because there's this mixing cycle that the lower part of the stomach will contract and push the food back up in order to go through another mixing cycle of acid. And then many times that the pyloric sphincter is open, so that acid goes into the pyloric sphincter because it's supposed to stay open, goes through the pyloric sphincter in the esophagus and will cause burning. Because the stomach is supposed to withstand a high pH, but the esophagus isn't. So what happens is the esophagus, because of that acid, starts to erode and starts to break down, and then it has to adapt. It says, if I don't adapt to this environment, then you're going to bleed out. And so the tissue adapts, and that tissue adaptation eventually turns into cancer. So that's why actually what we do is we raise their stomach acid. Okay. So we raise the stomach acid. That's what we do. And interesting enough, people get better doing it. All right. All right, guys. I'm just scrolling through. Thank you guys so much for your questions, guys. Let's take another one from YouTube. So how to heal the lungs from cigarette smoking if possible. Well, cigarette smoking, basically what it does is it damages the lung barrier. So, can it heal? Yeah, it can heal unless you've been smoking so long in which you have scarring and things like that from so much damage. So it's kind of like, guys, anything that produces an inflammatory response is you're going to have inflammation. But if you keep hammering it over and over and over and over again, then you will get eventually scarring and loss of tissue function. I'll give you a perfect example. If the liver is inflamed, then you're going to have like fatty liver. So like fat moves into that area. And then like eventually, if you don't get to the reason why, then you will lose liver cells will die and they're replaced with scar tissues. That's why you call it non-alcoholic fatty liver disease or alcoholic fatty liver disease that then turns into a scarred liver. And that's kind of the end stage. So can you heal from cigarettes smoking? First thing I would do is stop smoking. That's the best thing that you should do. And then support specifically those barriers in order to help create healthy tissue as well. So that's the first thing I always tell people, like with inflammation, is don't cause it, don't injure it. The body, when doctors say, oh, but inflammation is good, I'm like, I agree, it's good. You need it when you have some level of injury. But if you can prevent it, it's not like saying like, here, like I'm going to go sprain my ankle because inflammation is good. It's needed to heal, but if it never ever goes away, there's going to be a long-term consequence of it. Okay. All right. So Envision Studios at the 50th age, thought on colonoscopy versus Cologuard tests. Touched on it earlier tonight. Do you reveal more than just potential risk for colon cancer? So I actually had a consult today with an individual who is 51, and she's bleeding. So there is not just like blood around the stool. It's actually within the stool. It's bright red. I said you either have an internal hemorrhoid or something is getting very irritated and it's passing along, and so it could be a colon polyp, or it could be, unfortunately worse, it can be colon cancer. For her, I told her to get a colonoscopy, and I said it's low enough where they can probably get some good information from that. You have, visible, obvious symptoms, so go ahead and get a colonoscopy. But if someone doesn't have any issues, then Cologuard can be good. And basically, it's a stool test, and you're looking for the presence of certain things that are um, conclusive for colon cancer, although usually they'll follow up with a colonoscopy after that. If someone has no issues or anything like that, I'm like, you can do a stool test, because a stool test will look at the physiology. So think of this: go in with the camera and you're looking for, the presence of a polyp or a tumor, and then a Cologuard would be a next step down. And then even doing a stool test would be, looking, instead of at a polyp, you're looking at the physiology that could have created it. So that's why when you look at a stool test, one marker that has been associated with an elevation of colon cancer is called beta glucuronidase. And we have seen it sky high in people. I'm like, you let that hang around, you're going to be a good candidate for colon cancer later on. And so again, colon cancer it's a tissue response, again, to injury, just like Barrett's esophagus or esophageal cancer. The body says, this is a terrible environment. I can't live this way. So I need to adapt and I need to change. And that's how we look at cancers. We look at it as an adaptation. It's an adaptation of the body to try to help you live as long as possible. Okay. So yeah, if you don't have any issues, you can option for the Cologuard, or even get a stool test, even if you want to get a little bit deeper. Patricia Herzog, thank you for your question. Can you use berberine daily? That depends on the strength of the berberine. Okay. That's going to depend on it. And I will tell people this. I'm like, if you aren't working specifically with a Wellness Way doctor, and measured blood sugars, A1C, your insulin levels, things like that, they may put you on a berberine like Golden Seal or Oregon Grape. They may even put you on Gymnema. Can you take it daily? Depends. Golden Seal can be really hard on the gastrointestinal system long term, because it can kill off some bacteria. Oregon Grape is a little bit more gentler on the body. But can you take it daily? Yes. In fact, if you look at berberines and how they help with energy utilization of glucose in the cell, it can be very wonderful to use. The only problem is that sometimes people don't take it in high enough doses. And I think if you're talking about weight loss, I think it needs to be at a minimum of 250 milligrams. I think 1,000 is better. But you need to ramp it up even into like 1,500 sometimes. Milligrams of something like Oregon Grape. And everyone's going to go out and get to Oregon Grape. Don't do it. Get tested first. But thank you very much, Patricia. All right. Let's see. All right. From Instagram. What about a reflux with a hiatal hernia? Can you heal it without surgery? You still want to raise stomach acid? The biggest thing with a hiatal hernia is find someone who is well-versed in visceral manipulation. We've had people who have had a hiatal hernia, and you can do visceral manipulation and move the stomach down under the diaphragm, and it works. It's painful to do it, but it works. And if you can get that portion of that stomach to squeeze underneath the diaphragm, then usually you don't even need, it's not an issue of why there's an issue with stomach acid as well. You're just having a hard time getting that food to go down because it's stuck above the diaphragm. When are you bringing a clinic to Dallas, Texas? Oh, I don't know. I'm sure in the future there will be a clinic in Dallas, Texas, but I know that there is wonderful clinic in the Houston area. So you can look them up. It's only like an hour drive, right? All right. All right. So from Doug Cathy, I babysit a 3-month-old baby having a hard time with her bowel movements. All right. What can help with that? Um, that's a good question. You probably need to dig a little bit deeper because I would ask the questions with the 3-month-old. Is the 3-month-old, how were they born? So did they have any kind of birth trauma? Did they have, are they, did mom breastfeed? Are they currently breastfeeding? Are they doing formula? Um, and because there can be a difference between a C-section, and there can also be a difference between going through the vaginal canal. Was there any kind of mechanical trauma to that puts that baby in a very tough place to be able to get into rest and digest? Those are just some of the things. And I remember, guys, one of the biggest things that can help a baby is a chiropractic adjustment. So I was known as the I would help babies poop almost immediately. So we'd give a very light adjustment, top part of the neck, put them in rest and digest, and within like a minute, they were soiling their diaper after being constipated for 3 or 4 days at a time. So um, let's see. All right, gestational diabetes, anemia during pregnancy. Any thoughts? Okay, so if there's gestational diabetes, then there probably was some issue prior to becoming pregnant. And then anemia during pregnancy. Just remember this is if you are kind of borderline low and then your blood volume expands during pregnancy, then you're definitely going to be low with that. And so that's why going into pregnancy, it's really important to be really, like healthy and rock solid. In fact, when people come to me because they really want to conceive and they're having difficulties doing that, I'm like, don't try to conceive until you clean some of these things up, or else there's just more likely to have constipation or some complications and things like that. All right. Guys, we're at about 7:37. So like I have like 3 minutes left. I appreciate all of your questions. Um, Dr. Emily Manoogian said that melatonin inhibits insulin secretion. Is she correct? Huh, that's interesting. Well, I will tell you this is we do not. I don't recommend that people take melatonin. In fact, the only times that we have people take melatonin is especially if their organs like the testes or the ovaries are really, really beat up. So melatonin does involve certain hormone pathways similar to estradiol as well. But the only time it's not necessarily to help sleep because it's a repair hormone. So that's why melatonin is high at night, because that's when the body is recovering and repairing. And so very, very few people do we ever have them go on exogenous melatonin. But I do think that people take it way, way too often to try to help them sleep. And I'm like, they're what would be way, way better is because they think that it's going to shut down, the brain. And I'm like, there's things that are better than melatonin for that purpose. Things like California poppy or chamomile or kava or L-threonine, things like that can help. And it's not necessarily, in fact, a lot of people sometimes when they do take exogenous melatonin, they'll have night terrors or they'll feel very almost hungover the next day from taking it. All right. Last question, guys, and then I got to run. Thank you guys so much for joining us. So what is an alternative to a root canal besides pulling a tooth? There really isn't. And I'm not a dentist. I have done a lot of myself with biological dentistry. I've referred a lot of people for biological dentistry. But if the root is infected, that's why you can still sustain an infection underneath, not where the tooth was at, but in the root, because there's just miles of tubules in there, and that's where you can fester an infection. So how do you get rid of it is pull the whole entire root and the periodontal ligament. So an alternative to a root canal, is I would actually just pull the tooth. I would pull the tooth, and then what I would do is I would get a bridge versus getting an implant. Because again, if you get an implant, you are going to be putting in you're going to put metal into bone, and that can trigger the immune system as well. A lot of people, when they do get their root canals pulled, they do feel a lot better because they're lowering infection that's taken place. So what's interesting is there's even a lot of people who get a root canal and they still have necrosis or destruction of the bone because that infection didn't get cleared out and was just festering in the root and went all the way down into the mandible. Okay. All right. Valerian root can also help, yes, as well. So there's a lot of different things that have a sedative property. Okay. All right. So guys, it's 7:40 and I need to run. So as always, I appreciate spending time with me. And also remember this is make sure you get your tickets for I Disagree with Dr. Patrick Flynn, October 24th, 2023 here in Yorkville, Illinois, Whitetail Ridge Golf Club. If you don't do anything for me, please be at that event. I would love to be able to meet all of you, to be able to talk to you, to give you a handshake or a hug if you prefer that. I would love to meet all the people that follow me. Do what you can in order to get that event. I guarantee it will change your life. Make sure you get your tickets after September 24th. Ticket prices are going up, so get your tickets now. You can follow the link on Linktree, and you will see the I Disagree tour. You can get those tickets on Eventbrite. So, guys, thank you again for joining. Next week, we will also be doing a question and answer live, only because I won't be able to have time in order to come up with a live topic. But if you do have a topic, let me know, and I can put it on the back burner for a couple of weeks from now. So guys, thank you so much for joining me. I will take this Instagram live and I will also post it to our timeline. So guys, be well. Make sure you share this video. Make sure you like, follow, share.